Let's discuss this with Benjamin Neuman, a professor of biology and also the chief virologist at the Global Health Research Complex. And he joins us from College Station in Texas. Welcome to TRT World. So you're in the US, and the US declared that polio had been officially eradicated in 1979. So why is it back in the US and in other countries?
Right. And so far, what they're detecting right now is a bit of polio in the sewers, and that could have a couple different causes. So, with the decrease in vaccinations and the increase in vaccine hesitancy, I think we will be seeing some viruses come back. But we're not sure if this is it right now or if this is just a prelude, if it's actually coming later. Some people who are vaccinated actually will develop become a lifelong carrier of polio. And so it's possible that they're tracking an infected person who's been infected for a long time rather than an outbreak. But doctors and epidemiologists will be looking at this right now to try and tell the difference.
And this is very concerning. I'm sure, our viewers watching this right now are wondering exactly who is at risk and where.
Yeah, theoretically, anyone who's not vaccinated or anyone whose vaccine has kind of lapsed. As we've seen with the COVID vaccines, immunity doesn't ever last forever, even though in the past we could sometimes treat it as if it did.
Mm-hmm.
I think the important
Benjamin,
thing
if I
here
can
is
just jump in, when does a vaccine lapse? I think, I've had my polio drops many years ago. When exactly does a vaccine lapse? I'm scared.
Yeah, and the answer is there's no hard and fast rule.
Okay.
But if it's been something like 20 years, it might be time for a booster. Yeah, there wasn't much need for it before, and there may be going forward.
I think I'm on that list for a polio booster. So what advice do you have for our viewers on how to stay safe? Because this is quite alarming. And also we've heard about measles, in Zimbabwe. And of course, we are an international channel.
So every infectious disease is actually preventable one way or another. You can prevent it at transmission. Poliovirus is one of the few viruses you can actually wash your hands and stop. That doesn't really work for COVID, but yeah. Vaccines are very nice, and we've made a lot of progress there, but we have ways to control each one of these, and it's a little bit different for each one. But people are working on this, and I think we're paying attention to small outbreaks, and that's good. It's good that these things are on everybody's radar and that we can actually deal with them while they are small. Because as we've seen, if we don't do that, then these viruses can just grow and grow.
Great to speak to you, Benjamin Neuman, there, speaking to us from College Station in Texas. Really appreciate your time and your expertise.